The first step in this skill is to clearly explain the procedure to the patient. After we've done that, we need to establish and set up our equipment. Our equipment that we'll need for this skill includes our IV solution, our administration set, our IV catheters, our sharps container, and our universal start kit. The first item that we're going to set up is our IV solution. First, need to make sure that we have the correct solution. We need to make sure that it's clear and there's no particulate matter in it. We need to make sure that it has a good expiration date, and we need to make sure that the tail ports have the correct cover on them. Next is our administration set. For this, we'll be using a 10-drop set. After we've chosen the correct administration set, we'll go ahead and remove it from the packaging, and we'll go ahead and untangle the tubing. From here, we want to make sure that the protective caps are on both ends, and we want to move the flow clamp close to the drip chamber. From there, we'll remove our saline solution from the packaging, remove the tail port cover, we'll remove the cover from the drip chamber, and we're going to spike the bag by pushing and twisting them together. Once we've broken the seal, we'll go ahead and turn the bag upright. We'll squeeze the chamber until it's about halfway full. From there, we're going to purge the air out of the administration set. Once the air has been purged from the line, we'll close the flow clamp. We'll take the bottom of the administration set and attach it to the flow clamp. And from there, we'll hang the saline solution where it needs to go. After we've set up our saline solution, our administrative set, we're going to get ready to perform a venipuncture. At this time, we need to set up our equipment. Well, first, we're going to set up our tape. After that, we're going to set up our alcohol swab, our gauze 2x2, and our occlusive dressing, which in this case happens to be a Tegaderm. After that's completed, it's time to put our PPE on. We're going to let the patient know that at this time we're inspecting for a possible site for cannulation. Once we've found a site that we think will be okay, we're going to head and apply our tourniquet. Once the tourniquet has been applied, we can go ahead and palpate the area. Once we're satisfied with it, we'll go ahead and pull our alcohol swab out, and we'll clean using an aseptic technique, starting inside and working out. Once the area has been cleaned, we're going to go ahead and choose the appropriate IV catheter. In this case will be a 20-gauge IV catheter. We're going to try and maintain its sterility as much as possible as we pull it out of the packaging. Once we have it, we'll go ahead and pull the cap off. We're going to inspect for burrs, and we're going to loosen the hub. From here, we're going to let our patient know that we're getting ready to perform the puncture. We're going to grasp the arm from underneath, pulling the skin tight so that the vein is stable. We're going to come in with the stylet bevel up at a 45-degree angle, and what we're looking for here is as we insert a pop and as well our flash chamber filling. Once we have the flash chamber filled and we felt the pop, we're going to go ahead and lower 1/8 to 1/4 of an inch, advance the catheter till the hub meets the skin, and lock out our needle. From there, we'll go ahead and pinch the hub in place, or remove the needle, and sharps it immediately. At this time, if we needed to perform a venous blood draw, we could by attaching a syringe and drawing back. Since we don't need to, we're going to go ahead and attach our administration set, release our tourniquet, and we're going to go ahead and open up the flow, looking for a patent line. At this time we have a patent line. We can go ahead and secure it using the Tegaderm. Once the line has been secured, we're going to be inspecting for infiltration and any kind of irritation. We're also going to be inspecting for the therapeutic effect of our normal saline solution.